Finally, I want to talk about depression in women. I said that depression affects women 1.5 more times than men, but that does not mean that men are not affected. Men are affected, but sadly enough, our men don't want to talk about how they are feeling. They don't want to talk about when they are struggling. They don't want to be seen as weak, and they don't want the society to judge them. And depression is not a sign of weakness. Depression is an illness that needs to be managed like any other. So many men don't seek for treatment for depression, and they end up feeling hopeless, worthless, and lose interest for life. And when we talk about suicide and statistics for suicide, we see that men commit suicide more than women because they don't talk about it. So I encourage men to talk about it, because it's okay not to be okay. So when we are talking about depression in women, women are more affected by depression because, number one, because of biology, the hormonal changes that happen during the premenstrual period, the menstrual period, the pregnancy period, the time after pregnancy, and even the perimenopausal, the time before menopause. All these changes in estrogen and progesterone that takes place during that time, they predispose women to depressive episode. The other factor that makes women more affected is social factors. Women are always on the receiving end of things. When it comes to unemployment, most women are more unemployed than men. When it comes even to those employment, there is inequality of what is going on at the workplaces. Women are on the receiving end of trauma, whether physical trauma, gender-based violence, sexual trauma, rape, and or even rape in marriages, emotional trauma, neglect, trauma. Many women are faced with a lot of trauma. Responsibility. Women carry the society. They have a lot of responsibilities, either to their children, to their parents, to their spouses. They carry a lot of burden, and that burden sometimes can overwhelm them, especially when they even don't have the capacity to carry that burden. So the nurturing nature of women predisposes them to depression, and they can have either depression during the period, the PMS, the period before menses, a week before, when they become very irritable and not a good time to deal with them. Of course, the perinatal depression that takes place during pregnancy and after delivery because of the changes of the progesterone hormone that happens during that time, and the time they are transitioning to the menopause, perimenopausal depression, where women present with anxiety, sadness, loss of energy, loss of interest, and a lot of irritability. All these things makes depression be more common in women. But the good thing with women is that they talk about it and they seek care. When they are not feeling well, they are able to talk about it. So let's talk about it. And when you have depression, what do? Depression is manageable. People don't snap out of depression. You have to be treated. And they said untreated depression either get worse or bring about other bad things. So depression is managed. Number one, after diagnosis of depression, you can either see a psychologist or a therapist or a counselor who takes you through counseling and therapy services to handle what happens with depression. There are procedures that are done by therapists to handle depression. The other method, of course, is to have medication, whereby then you see a specialist who prescribes medication. And depression medication are not addictive. I've had many patients refusing treatment for depression because they feel that the dowers are addictive. They are not addictive, and you don't take them forever. At some point, they are stopped. Of course, we also have treatment-resistant depression that needs more than medication that I don't need to discuss with you. So depression is treatable. Depression is a cause of disability and disease burden in the world. Depression is one of the biggest risk factor for suicide. Let's talk about depression. Let's talk about mental health. Let's stop the stigma. Let's help the people who have depression in our society, in our family, in our workplaces. Look at a person and you see that they have changed in one or another. Please reach out and help them. We are here and we are willing to help them. Thank you.